Have you ever found yourself constantly clearing your throat or feeling that nagging, irritating sensation that just won't go away? You know that feeling when you're trying to speak or breathe normally, but your throat seems to have a mind of its own, demanding that you clear it every few seconds. If this sounds familiar, you're not alone. Throat clearing is a surprisingly common issue that many people face. However, if this persistent clearing is more than just a minor inconvenience, it could be an indication that something else is going on. Phlegm buildup in the throat is one of the most frequent culprits behind this uncomfortable problem. But before you jump to conclusions, it's important to understand that this isn't just about a simple cold or seasonal allergies. The causes of phlegm in your throat can be more complex than you might think, and understanding the root causes is the first step in finding a solution. So why does phlegm build up in the throat in the first place? What exactly causes it, and how can you reduce the discomfort? Let's dive in and explore the three primary causes of throat phlegm and how each one affects your body in unique ways. But before we begin, I'm curious about you. Where are you watching from? Let me know in the comments and feel free to ask any questions you might have. Now let's get started. Number 1, post-nasal drip. Have you ever woken up in the morning feeling like there's something stuck in your throat? That annoying, persistent tickle that just won't go away, no matter how many times you clear your throat? Or maybe, throughout the day, you find yourself constantly clearing your throat, trying to get rid of that feeling, but it just keeps coming back? If this sounds familiar, chances are you're dealing with a condition known as post-nasal drip. And it's one of the most common and frustrating causes of throat irritation that many people don't even realize they have. Post-nasal drip occurs when excess mucus from your sinuses drips down the back of your throat, triggering that incessant need to clear it. The sinuses are small cavities in your skull that help warm, filter, and moisten the air you breathe in. They also produce mucus, which is a crucial part of your body's defense system. This mucus traps allergens, dust, bacteria, and other irritants that might otherwise make their way into your lungs. Normally, this mucus flows down the back of your throat without you even noticing, where it gets swallowed and eventually makes its way into your stomach. But when something goes awry in the sinuses, whether it's an overproduction of mucus or inflammation caused by infection or allergies, the mucus doesn't drain properly. Instead, it accumulates in your throat, and that's when the trouble begins. The excess mucus triggers irritation in the throat, and your body responds by signaling you to clear your throat constantly. It's as if your body is telling you, hey, something's not right here. And no matter how many times you try to clear your throat, it just doesn't seem to go away. This constant throat clearing can be so annoying, especially if it happens regularly. It's not just uncomfortable, it can also be embarrassing. You're in a conversation trying to get your words out, but that persistent throat clearing keeps interrupting your flow. You might feel like everyone around you is noticing, and it's hard to focus on anything else because all you can think about is that feeling in your throat. Trust me, you're not alone in this. Many people experience post-nasal drip, but the good news is that it's usually treatable once you understand what's causing it. So why exactly does post-nasal drip happen? To answer that, we need to take a closer look at the sinuses and how they work. The sinuses produce mucus as part of their natural function, but this mucus is supposed to be thin and fluid, allowing it to drain easily through tiny passages into the back of your throat. This drainage usually happens without you even noticing it. But when your sinuses are irritated, whether from allergies, a cold, or even a sinus infection, the mucus production ramps up. The mucus may become thicker, stickier, and harder to drain. It's this thick mucus that drips down your throat, causing that uncomfortable sensation. It's also important to note that post-nasal drip isn't always just about a simple cold or allergies. Sometimes it's the result of more chronic conditions, like sinusitis or rhinitis. Sinusitis is when your sinuses become inflamed and infected, often causing pain, pressure, and the overproduction of mucus. Chronic rhinitis, on the other hand, is when your nasal passages become inflamed, leading to a constant drip of mucus. Both of these conditions can lead to post-nasal drip and that incessant throat clearing. But let's go back to that sticky feeling in your throat. Picture this. It's the morning and you wake up with that familiar sensation of something sitting at the back of your throat. You try to swallow, but it feels like there's a lump that just won't go down. Maybe it feels thick or gooey, and no matter how many times you try to clear your throat, the sensation persists. This is where post-nasal drip really comes into play, especially when you're lying down. At night, gravity can cause mucus to accumulate at the back of your throat, leading to that feeling of congestion and irritation upon waking. It's worse if you're already dealing with nasal congestion or allergies, making it even harder for your sinuses to drain properly. The frustration of post-nasal drip doesn't end with mornings. Throughout the day, if the mucus continues to build up, it can lead to coughing, throat clearing, and a general sense of discomfort. That constant need to clear your throat can be draining, literally. It's as if your body is stuck in this cycle of trying to get rid of the mucus, but no matter how much you try, it just doesn't seem to go away. And let's face it, it's hard to focus on anything else when all you can think about is the discomfort in your throat. Now let's talk about what could be causing your post-nasal drip. One of the most common culprits is allergies. Seasonal allergies, in particular, can wreak havoc on your sinuses and lead to an overproduction of mucus. When you're allergic to something like pollen, dust mites, or pet dander, your body's immune system goes into overdrive, producing excess mucus to flush out these perceived threats. This extra mucus can accumulate in your throat and trigger post-nasal drip. It's no surprise that many people notice their throat clearing is worse during certain times of the year when allergens are most prevalent. Colds and flu are another common cause of post-nasal drip. When you catch a virus, your sinuses become inflamed and your body produces more mucus to help trap the virus and flush it out. This excess mucus can easily drip down the back of your throat, leading to that annoying feeling. Infections like sinusitis can also lead to chronic post-nasal drip, especially if the infection doesn't clear up on its own or if it becomes recurrent. But post-nasal drip isn't just limited to colds, allergies, and infections. Changes in the weather can also play a significant role. Have you ever noticed that your throat feels drier or more irritated when the air is colder or drier? This is because changes in temperature and humidity can affect your sinuses and the consistency of your mucus. Cold, dry air can cause your nasal passages to become inflamed, leading to mucus buildup that drips down the back of your throat. Similarly, during hot, humid weather, your body might produce more mucus to help keep your airways moist, which can also lead to post-nasal drip. Now that we understand what causes post-nasal drip, it's time to talk about how to deal with it. The first step is to identify the cause of the issue. Are you dealing with allergies, a cold, a sinus infection, or is it something more chronic like sinusitis or rhinitis? Once you've identified the cause, there are a few things you can do to alleviate the symptoms and reduce the discomfort. If allergies are the culprit, over-the-counter antihistamines can help reduce the amount of mucus your body produces. Nasal sprays, like saline sprays, can help moisturize your nasal passages and encourage proper drainage. Avoiding allergens, such as staying indoors during high pollen seasons or using air purifiers in your home, can also help reduce the buildup of mucus. Number 2, acid reflux. If you've ever experienced a burning sensation in your chest, a sour taste in your mouth, or that uncomfortable lump in your throat feeling, you might be familiar with acid reflux. But what happens when acid reflux makes its way up into your throat? That's when it turns into something a bit more specific: laryngopharyngeal reflux, or acid reflux in the throat. This condition can lead to persistent throat clearing, hoarseness, coughing, and even that nagging sensation of something stuck in your throat. It's a cause that's often overlooked, but if you've been dealing with constant throat clearing and irritation that just won't seem to go away, acid reflux could be the culprit. Let's break it down. Acid reflux occurs when the lower esophageal sphincter, LES, which is a muscle that normally separates your stomach from your esophagus, becomes weakened or relaxes when it shouldn't. This allows stomach acid to flow back up into your esophagus. Normally, your LES should act as a valve, preventing stomach acid from rising up. But when the LES doesn't function properly, acid can make its way up the esophagus and in some cases even into the throat, causing irritation. That's when you start feeling that lump in your throat, a dry cough, or the constant need to clear your throat. The problem here is that the throat is much more sensitive to acid than the esophagus. Even small amounts of stomach acid can trigger discomfort, inflammation, and irritation. Your body then responds by producing extra mucus or phlegm in an attempt to protect the lining of the throat. The phlegm is your body's way of dealing with the irritation, but it ends up leading to that constant need to clear your throat, further aggravating the situation. Now, you might be wondering why this tends to happen more at night. The answer is simple: gravity. During the day when you're upright, gravity helps keep the stomach acid where it belongs, in your stomach. But when you lie down, gravity no longer has the same effect, and the acid can more easily travel upwards into your esophagus and, in some cases, reach your throat. This is why people with acid reflux often experience worse symptoms at night, waking up with a sore throat, hoarseness, or that dreaded feeling of something stuck in the back of their throat. It's not uncommon for these symptoms to be at their worst when you first wake up, as the acid has had time to irritate your throat while you were lying down for hours. Another aspect of acid reflux that can exacerbate throat clearing is the fact that it's not always just about heartburn. While heartburn is a well-known symptom of acid reflux, it's not the only one. In fact, many people with LPR don't experience classic heartburn at all. Instead, their symptoms are more focused on the throat, leading to hoarseness, a feeling of a lump in the throat, a chronic cough, and of course, that persistent throat clearing. These throat symptoms are often what lead people to seek medical advice, not realizing that acid reflux is the root cause. So what's going on here? When acid reaches the throat, it can irritate the lining of the larynx, your voice box, and the pharynx, the back of the throat, which are more sensitive than the esophagus. This irritation causes inflammation, leading to the production of mucus as a protective response. This mucus can feel thick and sticky, creating that uncomfortable phlegm sensation in the throat. As a result, your body may feel the need to clear the throat constantly to get rid of the mucus buildup. But the more you clear your throat, the more irritated your throat becomes, leading to an endless cycle of discomfort. Now, how can you manage acid reflux if it's the cause of your throat clearing? The first step is making some lifestyle changes. One of the most effective ways to manage acid reflux is to adjust your diet. Certain foods like spicy dishes, citrus fruits, chocolate, and fried or fatty foods can trigger acid reflux symptoms. Reducing your intake of these foods can help reduce the amount of acid your stomach produces, which can in turn reduce the chances of acid reaching your throat. Additionally, eating smaller meals more frequently throughout the day rather than large meals can help prevent the stomach from becoming too full, which can also cause acid to back up into the esophagus. Another important lifestyle change involves avoiding eating close to bedtime. When you lie down right after eating, gravity isn't able to keep the acid in your stomach, making it easier for the acid to reach your throat. Ideally, you should aim to finish eating at least 2 to 3 hours before going to bed to give your body enough time to digest the food. If you're prone to nighttime reflux, elevating the head of your bed can also help, as it allows gravity to work in your favor and keeps acid from flowing up into your throat. Number 3, infection. Infections are another common cause of phlegm buildup in the throat, and they can be incredibly frustrating, especially when they lead to constant throat clearing. Whether it's a viral infection like the common cold or flu, or a bacterial infection like strep throat, the presence of an infection in your body often triggers an increase in mucus production. This increase is your body's way of fighting off the invading pathogens, but it can also cause significant discomfort in the throat. When your body is working to expel bacteria or viruses, it produces excess mucus, which can accumulate in the throat, making you feel like there's something stuck there that won't go away. The link between infection and throat clearing is not always immediately obvious, but if you've ever experienced a sore throat along with a thick, uncomfortable sensation in the back of your throat, you know how irritating it can be. The phlegm doesn't just appear out of nowhere, it's the result of your body's natural defense mechanisms kicking in. When an infection takes hold, your body goes into overdrive, working to trap and eliminate harmful microbes. This leads to an increase in mucus production as a form of protection. The mucus works to capture the bacteria or viruses, helping to prevent them from spreading further into your respiratory system. However, this excess mucus can end up in your throat, leading to that uncomfortable, constant need to clear it. Infections caused by viruses, like the common cold or the flu, are especially notorious for causing throat irritation and excessive mucus production. When you catch a viral infection, the virus often targets the upper respiratory tract, including the nose, throat, and airways. As your immune system tries to fight off the virus, it produces mucus to trap the virus particles and prevent them from traveling deeper into the lungs. The result is often a raw, irritated throat that feels like it's full of thick mucus. This phlegm can become even more bothersome when you're lying down, as it tends to pool in the back of your throat, making you feel like you need to clear your throat constantly. A common symptom of viral infections is that the mucus in the throat can change in color and consistency as the infection progresses. In the early stages of a cold or flu, the mucus may be thin and clear, but as the infection worsens, the mucus may become thicker and change to yellow or green. The change in color is often a sign that your immune system is actively fighting the infection, as your body sends white blood cells to the site of infection to help neutralize the pathogens. While green or yellow mucus is often associated with bacterial infections, it can also occur with viral infections, so it's not always a definitive indicator of a bacterial infection. Bacterial infections, like strep throat, can also lead to a similar buildup of mucus in the throat, but the symptoms tend to be more severe and localized. Strep throat, for example, often causes intense pain in the throat, difficulty swallowing, and fever. It can also lead to an increase in mucus production, which irritates the throat and can make it feel raw and scratchy. In the case of bacterial infections, the mucus may become thicker and more difficult to clear, making it harder for you to get relief from throat irritation. With strep throat specifically, the mucus might also have a different consistency, potentially making the throat feel more congested or blocked. This type of infection requires medical treatment, as antibiotics are often necessary to clear the bacteria from the body and prevent further complications. Infections can also cause inflammation in the throat and airways, which can aggravate the phlegm buildup even further. When your throat becomes inflamed, the lining of the throat swells, making it feel tight and uncomfortable. This inflammation can make it more difficult for the mucus to drain properly, causing it to accumulate in the back of your throat. The more mucus that accumulates, the more irritation and discomfort you feel, leading to that constant need to clear your throat. If you've ever had a viral or bacterial infection, you know how irritating this can be, especially when the mucus seems to get thicker and harder to clear over time. Chronic infections, such as chronic sinusitis or chronic bronchitis, can also lead to persistent throat clearing. Chronic sinusitis occurs when the sinuses become inflamed for a prolonged period, often as a result of a viral, bacterial, or fungal infection. When the sinuses are inflamed, they produce excessive mucus, which can drip down the back of the throat, a condition known as post-nasal drip. This constant flow of mucus can irritate the throat and lead to that nagging feeling of needing to clear your throat. Chronic sinusitis can also cause facial pain, pressure around the eyes and nose, and a stuffy nose, all of which can contribute to the discomfort of phlegm buildup in the throat. Similarly, chronic bronchitis can lead to persistent mucus production in the lungs and airways. Bronchitis is an inflammation of the bronchial tubes, which are the air passages that carry air to your lungs. When these tubes become inflamed, they produce excess mucus, which can travel up the throat, causing irritation and triggering that need to clear your throat. Chronic bronchitis is often associated with a persistent cough, and the mucus can be thick and difficult to clear, leading to further throat discomfort. In both cases, the mucus that accumulates in the throat as a result of chronic infections can lead to long-term irritation and persistent throat clearing. When dealing with infections that cause phlegm buildup, the best course of action is to treat the underlying infection. For viral infections like the common cold or flu, the treatment is usually supportive, focusing on relieving symptoms while your body fights off the virus. This might include taking over-the-counter medications like decongestants, pain relievers, or cough suppressants to help reduce symptoms and make it easier to breathe. Staying hydrated is also crucial, as it helps thin the mucus, making it easier to clear from the throat. In addition, using saline nasal sprays or doing steam inhalation can help loosen mucus and clear out your sinuses. For bacterial infections like strep throat, antibiotics are typically prescribed to help kill the bacteria and prevent complications. In some cases, your healthcare provider might also recommend medications to help soothe the throat and reduce inflammation. If you suspect that you have a bacterial infection, it's important to seek medical attention to get the proper treatment. Left untreated, bacterial infections can lead to more serious complications, such as an ear infection, sinus infection, or even kidney problems. For chronic conditions like chronic sinusitis or bronchitis, the treatment approach may involve a combination of medications, lifestyle changes, and in some cases, surgical intervention. If you have chronic sinusitis, your doctor may recommend nasal corticosteroids to reduce inflammation or even surgery to clear out the sinuses if other treatments aren't effective. Similarly, managing chronic bronchitis often involves quitting smoking if applicable, using bronchodilators to open the airways, and taking medications to reduce inflammation. If you found this video helpful, be sure to like, subscribe, and share it with anyone who might benefit. And as always, keep feeling your best. See you in the next one.